Dengue fever is a flu-like viral illness which is caused by a dengue virus which belongs to the group of Flaviviridae. This has many strains, but most of the dengue fever is transmitted by the mosquitoes. That is, the persons which are infected with the mosquitoes carrying the dengue virus can transmit this infection from one person to another through the mosquitoes as vectors. Now, coming to the symptoms of this dengue fever, usually there has been mild to symptoms and moderate to severe symptoms. The mild symptoms usually present as fever, severe headache, throat pain, generalized tiredness, severe body pain. Here actually the dengue fever already has a name as breakbone fever. That is, the pain will be so severe that is like you feel like the bones are getting broken. Also, some people can have difficulty in eating, they don't feel appetite, too much tiredness, lethargic, and pain in behind the eyes. All these are mild to moderate symptoms of dengue. But some severe symptoms are also associated with dengue fever, like severe nausea, vomiting, and the patient is having bleeding from nose, bleeding from gums, and there's bleeding in stools like that. This happens when the dengue virus in severe forms can attack the platelets and can reduce the platelet amount in the blood, which results in all these symptoms. And these symptoms can be so severe sometimes, this can even lead to bleeding in the internal organs, even in the brain, which can be very fatal for the patient. Coming to the diagnosis of dengue, how can we know that a person is having such symptoms and this is dengue or not? Usually, any person who is coming with this fever, body pain, and generalized tiredness which is persisting, we usually ask them to do a complete blood count, in which we can pick it up by a suspicious drop in the platelet count. If we get a suspicion like that, then we order for a dengue car test, which is called the antigen test, and we confirm it with the PCR test. And coming to the treatment part, there is no specific treatment for dengue. Actually, it is a supportive care that is needed for the patient. That is, the patient should be hydrated well, minimum to 3 to 3.5 liters per day water should be taken inside, and for the fever we'll give medicines. One very important factor to be kept in mind is that a patient who is suspected to be dengue should never be given over-the-counter medications for pain, that is painkillers like non-steroid anti-inflammatory drugs. We should always try to treat the pain or fever or body pain with paracetamol, which is the most safest medicine that can be used in a patient with dengue fever. Now, as we all know, prevention is always better than cure. So how can we prevent this dengue fever from coming to us? Any method which can prevent the breeding of these mosquitoes, this is the first step towards prevention of dengue. Another thing is that especially in mosquito-prone areas, whenever we go out to parks, all these places where children are taken, we should always try to make them put a long sleeve clothes so that they are covered totally, and use the mosquito repellents. All these are the certain other things which we can take care of. So main thing we have to make sure is that our premises should be clean and tidy and should be free of mosquitoes. So this is regarding a brief topic regarding dengue fever. Thank you.